Well, first of all Albertans support the fantastic work done by nurses and our other frontline healthcare workers. We appreciate so much, especially the work that they've done through the pandemic, and that's one of the reasons we provided the emergency worker top-up payments to just as it recognize some of the extra stress and work that many have gone through, many doing overtime hours, of course, particularly in intensive care units. This is one of the reasons why we've sought repeatedly to delay the collective bargaining. As you know, those agreements, those labor agreements, have a time limit on them, and precisely because we've wanted to focus on pandemic response, we've been seeking to delay collective bargaining. Unfortunately, from my perspective, the union decided that they did not want any further delays. They wanted the negotiations now. So we are responding, negotiating in good faith. We want to ensure that our nurses and other healthcare workers are not just generously compensated, but that we're happy to have them amongst the best compensated in the country. Alberta nurses receive on average about 5.6% higher compensation than in the rest of Canada. And as Dr. McKinnon's panel on Alberta's finances pointed out, we need to make an effort to operate more efficiently, and that includes labor costs in the health system that is nearly 45% of Alberta's budget. The Dr. McKinnon's panel suggested that aiming for the same level of or similar level of compensation as the other large provinces is a reasonable goal. Alberta has a $16 billion deficit. We've been running massive deficits for a decade. We cannot continue to do that indefinitely. This government, at least, is not going to raise taxes that would punish people who have already been hurting in the private sector. So we have to learn how to operate a little more efficiently, and that's the basis of our initial position in the collective bargaining agreement. But collective bargaining happens every few years. Governments have a responsibility to defend the interests of taxpayers. Unions have a responsibility to defend the interests of their members, and then you negotiate those differences in collective bargaining. That's exactly what's happening now. We have more nurses working in Alberta's healthcare system today than ever in our history. We have more physicians working than ever in our history. We are spending more tax dollars on healthcare than ever in our history. The healthcare budget, even without COVID, has gone up by nearly $2 billion since this government took office. So Alberta is spending more on healthcare on a per-person basis than every province in Canada, save one. We spend about 20% more on healthcare per capita than the average amongst the large provinces, even though we have the youngest population in the country. We compensate our physicians, nurses, and other frontline healthcare workers more generously than in other provinces, and I anticipate that will continue to be the case. So with a larger budget, more nurses and doctors, and generous compensation, this is a sustainable healthcare system, but we have to have sustainable finances to pay for it. We can't continue to run $10 billion, $20 billion deficits every year, because ultimately that will trap us in a sea of debt. We've been there before in Alberta. You might remember back about 25 years ago, the government of Alberta cut spending in the healthcare system by 20%, shut hospitals, had a 5% wage rollback across the board. We don't want to face those days again, and that's why we need to operate a bit more efficiently as we're seeking to do.